question, Director. How far are we from testing being available at each and every school in Rhode Island?
Our focus is for the September 14th timeframe that we will be ready with the test scheduling hotline in place and the test availability. So we will be ready by that September 14th timeframe.
Amongst the municipalities you stated, I'm talking like a brick and mortar school, a school nurse has tests available on site. Is that something that's even remotely attainable? Because we're getting emails already asking people, or people are asking that question.
It's a great question. It's the ideal that we want to strive for. We have this set up in the meanwhile now so that we can be ready to hit the ground running. But we want to continue to work with our school nurses who do a phenomenal job in helping to ensure that we have our vaccination rates what they are and taking care of kids in schools. It's a great place and infrastructure to build on to be able to support testing at the individual school as well. So through this school year, we're engaging all school nurses to work with us so that we can support them and figuring out how to build even more capacity at the school level.
Doctor, despite the enormous amount of comprehensive thought and planning that went into this and the very high quality of the science behind it, it seems to me that one of the problems that will follow from this process is that classrooms and students and their parents may engage in a kind of panic where as soon as a student in a classroom gets involved in this protocol, they have to vacate the classroom, stay home, go for testing, and so on. Parents may react by saying, A, we want to pull our kids out of that classroom to be extra safe, and B, because our kid was in close contact, even if they're asymptomatic in the same classroom, we want them tested too. And do you see that this might cause a certain amount of rolling disruption as one classroom after another encounters this? No matter how few students are actually infected by COVID-19, many more will need to be tested, and many more will be in proximity of those who need to be tested. And it seems to me that just like the virus itself, that kind of constructive panic, for lack of a better term, will spread exponentially.
Well, it gives an opportunity to come up with a better term than that. It's why we are here, talking to parents and to families so that there can be a sense of comfort and confidence in understanding how we are approaching it. This is something that everyone's going to be dealing with nationwide, and we are entering flu season and respiratory season coming into the winter. It's something many parents are already familiar with in terms of how to respond if their child develops respiratory illness or viral type symptoms. And we're adding to that with a system to support what can be done in that situation, which wasn't in place before. So the first key that I want to make sure parents hear is please make sure that you and your children get their flu vaccine this year. That's a critical message to relay to everyone. If you can get vaccinated against the flu, that will minimize how much we're wondering, is this flu, is this COVID-19, is this something else? So that's the first point. Everyone needs to get vaccinated against the flu, whether or not you've done it in the past. This is the year to do it, please. Secondly, for parents to understand, we are taking a very thoughtful and structured approach in how to engage. If there is someone within the classroom who has symptoms, we're going to quickly work to get them tested. We've talked about the isolation room that allows the child to, or the student or staff person to be removed from that classroom quickly. We have already done the work regarding stable groups and assigned seatings. So we will, in general, have a pretty clear idea of who has been involved and be able to quickly offer that guidance and support. And then parents can be reassured. But it's a normal process to be concerned. This is something we're all going to be going through together. The best we can do is talk to you about the system and infrastructure that we've built to respond to that.
Well, I do want to thank Mr. Wendelken of your staff for helping me on the article that will appear in tomorrow's Motif magazine about the importance of getting flu shots.
Great.
But what advice do you have very narrowly tailored to parents who are concerned in a specific way? I mean, can you sum up in a couple of sentences what should parents do if their kid is in a classroom with some other kid who might or might not have COVID-19 but has to be tested for it?
Parents can know that we have structures in place to, number one, minimize risk of transmission in everything that I've just described. And then number two, understand that we are going to be in a scenario where people will be exposed, whether or not it's COVID-19 or the flu or some other respiratory illness. All parents who have school-age children are already familiar with that process. This is not going to be significantly different, except that we have additional resources now to support. So we'll continue to go through this together, and parents can know in Rhode Island, you can be confident there's a system and teams of people who are standing ready to walk through this with you, the same way we have done with childcare. So it's helpful to talk to parents who have been experiencing childcare, and there have been ups and downs, but by and large, we have done well and have been held up as a model state for how to do it successfully.
Doctor,
Linda,
thanks. Governor, one of the questions that the NEA raised yesterday was that if parents are assured by your comments to return to school, but the schools haven't prepared for that influx of new kids, their partial returns may be all for naught. So what do you have to say for schools that prepared for X number of parents, and now suddenly parents are saying, oh gosh, it is safe, and so now schools are suddenly having perhaps, 30, 40, 70 more kids coming back that they planned for?
Let's get ready for that. Every child deserves an opportunity to get an education in school, with the exception of Providence and Central Falls, where we think it isn't safe. So, that's the job of these school administrators. That's what we have all been doing, preparing for every eventuality. So, they have a plan for full in-person, every kid, fully distant, every student, and options in the middle. So, listen, I am not saying this is going to be easy. That will be more work, more effort. Call the Education Operations Center. Get us out there. Let us help you. Let's get ready. But when there's a will, there's a way, and we'll figure it out. To your question, by the way, kids are out and about every day. They're in the grocery store. They're at the playground. They're in summer camp. They're playing sports. So, we've learned over I made the note that today was the 6 months anniversary, if you will. We've learned how to live with this. We are living with it. We're living with it. It's not gone. It's here, but we're living with it. And you have to, obviously, every parent has to do what they think is right for their kids. People say to me, what's the right answer? The right answer is what you feel is best for your kid and your family. But what I'm telling you is we think it's safe to go to school, and we're going to do everything we can to reduce the risk of your child getting sick.
Governor, more schools sent out an email this morning to parents that despite your announcement yesterday, they're sticking with it. Are you aware of that?
I just heard about it before walking in here. I think it's terrible. I really do, if you want my opinion. Listen, they did that some weeks ago before we made yesterday's announcement. They didn't even take the time to think about yesterday's announcement and try to make a plan. Immediately and summarily threw in the towel on all those children. I wouldn't be surprised if parents sue them, and I think they have a very good case. I don't know if there'll be any risk of them losing federal money on account of that. I don't know how you can make that decision in good conscience. I don't.
Is there more possibly behind the scenes here? They're the same AFT as Providence.
Yeah,
Does
possibly.
Providence have a contract? Is this part of the problem because Providence, or I'm not saying problem, but it's because Providence doesn't have a contract?
No, I don't think so. The superintendent in Providence is working his tail off to get as many students as possible into school. Obviously, we've said it can't be fully in person, No, I think this is just the decision of the Warwick School Committee to say, I don't know, we don't want to try.
You just finally, could you just, advice to Warwick parents, what should they do?
Yeah. My heart goes out to Warwick parents. My heart really goes out to the kids. Like, I don't know how to say it any more strongly. Like, a lot of you here are parents. These kids are going to miss out. They've already missed out on 6 months of school. Now they're going to miss out on another year of school. That could have permanent, lifelong consequences for these kids, many of whom they can't afford to go to another school. That is their only option. Their only hope for a good, prosperous life is a high-quality public education, and they deserve that. And we have said it is safe for that to happen. And so if I were a parent, call us. We'll help you figure out your legal options. We will help you think through it, because it's not right.
With the isolation rooms, if there's only one per school, what happens if 15 kids present symptoms?
So they're working it through. There'll be more than one per school. Again, this is going to have to be, we'll see how it goes. It depends on how many kids are in a school. Obviously, if it's a big high school with 1,000 students, that's going to be a different situation than if it's a small elementary school. There may be more than one room. We have given advice on, like, relative to the size of the school, how much space they have to have for isolation. And, but those will be all the practical things that we have to work through. Someone asked a question about in-school testing. We, as the doctor said, we had wanted that to happen, but we've been listening to the school nurses who don't want to be overwhelmed, and, you know, who could blame them? So at least now, as we're just opening school, we thought that it was better to not overly burden the school nurses, set up a whole separate system. Over time, as testing technology improves, as the nurses kind of get the hang of it, we see, to your question, how many kids get sick a day, we may get there. But those are the reasons that we said, let's just do it this way.